And hello to everyone in Poland and in Prague. Thanks for the opportunity to talk to me. I hope the audio is doing all right. I hope the audio is doing all right. And I would start right away by declaring my conflicts of interest. Important to point out that I have been invited to hold this talk, but PhysioAssist has taken no influence whatsoever regarding the content that I am presenting you, and I plan to present you in the next couple of minutes the structures of CF care in Germany, but also report our experience with employing the Semiox and treating patients with it. So this is the map of the CF landscape, the CF clinics in Germany. As you see, there are some areas with rather spare distribution of Southwest. There's quite a lot of smaller centers, and Tübingen, which is located here right south of Stuttgart, is one of the larger pediatric centers. We are treating about 150 children and young adults with cystic fibrosis, and we are a structure of the larger university hospital at Tübingen, which has quite a long history of treating CF patients. Before I come to the employment of Semiox, I would just show you some very nice results of the last few years of treating CF. We have made in providing as normal as possible qualities of life to our patients, and mean survival is rising each year, and it continues to rise. As a result of this, in Germany, we now have about 2/3 of patients who are adults, and so this means we are experiencing a changing distribution of patient age, which might provide a little challenge for our adult pulmonologists who are planning to treat these patients in the future. So this is the graph where you see that CF lung disease continues to be a big problem, and we especially have an eye on our younger teenagers and younger adults for monitoring them closely for lung function decline and exacerbation treatment, which is paramount in keeping patients active and well. And this is the graph where you see that we are quite successful in keeping children out of hospital. Our younger patients, 2/3 of them, do not have to be treated in the hospital, but there are also larger groups of children that experience exacerbation quite frequently, and we of course have the resources to help them, and this is where I come to my team. These are the people that I'm happy to work with every day. We have very qualified CF nurses who do all the organization, keep patients in close contact. We have a dedicated social worker who helps families cope with the illness, but also helps in discussing with social insurance and other stakeholders. We have specialized and very skilled physiotherapists. I will come back to this point later. And of course, we have a very well-trained dietitian who is helping our patients every day in trying to get as much calories as they need into them. So this is a larger team at the University Hospital. We always glad to have our specialists to discuss special cases, and among others, we have diabetology who is helping to treat CF-related diabetes and instruct our patient. So what do we do with our patients? We try to see them every 2 to 3 months, which was not quite easy this year because of the corona lockdown that happened in Germany also. But during these regular appointments, we always have a discussion with the treating physician. We always do lung function testing, take sputum cultures, and make sure that there are no questions left to be discussed with the dietitian. And then we also do advanced studies, which means that we have each patient seen by our specialized physiotherapist who has a room in our hospital, and patients go there and they have to bring their own inhaler device. They have to show how the inhaler technique is working, how they do their daily routine, and then we check the physiotherapy structures and exercises and give you instructions to take home and follow. Also, blood samples are being drawn, ultrasound, and imaging. These are done about every 1 to 2 years. And now I come to the application of Simiox. We are very happy to have some Simiox devices that we could purchase. And just a little reminder, although Professor Sanz has already pointed this out, all the patient has to do is inspire really slowly, and then during exhalation, the Simiox signal is being applied, and this helps to assist airway clearance, especially of the smaller airways. And also what I noticed when I first applied Simiox on my first patient, a 13-year-old girl with a massive hyperinflation, as you see here, the residual volume is increased dramatically, and after 1 month of treatment, it has not turned back to normal, but it has quite normalized. And this is just one recommendation I want to give you. If you want to document the effect of Simiox treatment, try to have body plethysmography performed to assess the amount of hyperinflation before and during Simiox treatment. We see this as a major effect in most of our patients that we treat with the Simiox device. Also, Professor Sanz already showed you these promising results. The small airway clearance is a major positive effect that we see in our patient as well. So how does physiotherapy work in our CF center? If patients are doing well, they have their physiotherapist close to their home. There's special quality criteria that apply to CF physiotherapists, and we encourage patients to see their physiotherapist once weekly, plus they should have a sport that they can perform once or twice a week, such as soccer or swimming. And to go along with this, we have our specialized physio who sees every patient once or twice a year during the checkup appointments at the center. And as I told you before, she's checking up on inhalation technique and is training for new exercises or new devices such as Simiox or flutter device. This is what we do if patients aren't doing this well. In case of disease progression, symptoms increase, or pulmonary exacerbation, we intensify physio at home. We have a mobile physiotherapist who comes to patients' home, and she provides them with the Simiox, gives an instruction, because as Professor Sanz already pointed out, it's easy to use, but it's not that easy to use. So we always make sure patients have the proper technique when giving them the Simiox. And then we leave the Simiox device with patients for about 3 or 4 weeks, maybe 6 weeks, before they return it to the center, where we do a checkup, including pulmonary function testing. And from the center, we have a close eye on these patients, because we want to see if they improve. We even have home spirometry that can be performed at home, and we see the results via email or internet. And we also employ our mobile physiotherapists and send them to patients' homes and manage medication from the center. And if in severe pulmonary exacerbation, an inpatient treatment is necessary for IV antibiotics, for example, we have the patients perform physio on the ward twice daily, and make them use Simiox 3 times daily. And after 2 weeks, when the IV antibiotic cycle is terminated, we send them home, discharge them, and leave the Simiox device with them for another 3 to 4 weeks, where they can use it for a longer period and then return it to the center. So this is the way where we manage our inpatients during the intensive treatment, along with the intravenous antibiotics. We have intensive physio, and along with that, apply Simiox a couple of times a day. And then after discharge, patients continue using Simiox at home, and then they return it to the center. And if we see in the final assessment that it is possible for patients to perform Simiox, and if they are motivated, and if we see changes in clinical parameters, and especially pulmonary function testing, we discuss prescription of a known device that patients can keep, and we then discuss it with the social insurance for reimbursement. And this is our way of action in patients who do not have to come for IV antibiotics. We also send our physio to the patient's home, and she is having a couple of appointments to make a proper training. And if this is working, patients use the Simiox along with their regular chest physiotherapy at home, and then they come back to the center. We make an assessment, make a good documentation, inclusive pulmonary function test results, and then we prescribe the Simiox if we see that this has been working good. So I come to my last slide. We see a new promising possibility in treating patients with Simiox along with regular conventional chest physiotherapy, especially for patients who have mucus plugging and along with that hyperinflation. Simiox is really easy to use and it is well accepted by patients. However, we always make sure that patients receive a proper training by a very skilled physiotherapist, and we always make sure that conventional chest physiotherapy is continued during the Simiox treatment. We have made very good experiences in trying out Simiox for about 4 to 6 weeks and then discuss the real prescription of an own device, and safety considerations do apply, but in our pediatric or young adult population, we feel very safe in using the Simiox. And for the last, I'm really happy that a couple of studies are underway, and this will make it easier for us to see who can have benefit from Simiox treatment, and also it makes it easier to discuss the reimbursement with the social insurance. Thank you very much, and I'm looking forward to our discussion.
Yeah, thank you very much. There are actually a few questions to you, Philip, and a lot of them concern organization, prescription rules, and reimbursement. Because of course we like the equipment, but there are pragmatic reasons coming in the way. We heard you have a certain possibility with Krankenkasse to prescribe it, and the questions are whether it could be just anybody who could like to have it, you could prescribe, or you have like a level care, first they should try with something else. And where is the equipment coming? You mentioned you make a trial period and then you have reimbursement request. Is it your center equipment you give home and then it's return? How does it work? So a lot of questions concerning that, prescription rules and reimbursement
All
rules.
right. Yeah. Okay. The first question is quite easy to answer because we have received a larger donation to the center, and from this money we were able to purchase a couple of Simiox devices that we can hire out to patients for a couple of weeks. So maybe this is the first answer that can help you. And these 5 Simiox devices, they actually belong to the clinic, and we can hand them out to patients. We always make a proper disinfection before patient change, but this is working really easily. And it's my my staff, the CF nurses, who do all the organization. To the second question, it's not that easy. Even in Germany, the social insurances, they have not accepted Simiox as a fund. So it's I hope you can hear me now. We have to discuss a prescription for every patient on a case-by-case basis with his insurance. And there are insurance institutes and companies who are very loose, who say, okay, that's okay for us to pay for this device. And there are others who like to have larger discussion where we have to provide larger documentation. And we also have patients who did not receive Simiox from their insurance company because they say there's still a lack of study data.
Yeah, thank you very much. I think our time passed very quickly. It was a very interesting hour, and it just showing that we need further studies, published studies on the device to help all this, pragmatic ways also to have the success to the patients. Yeah, thank you very much, all the participants and of course speakers, Professor Libius Smolikova, Dr. Philip Putz, and I hope to meet you soon in a kind of post-pandemic world. If not so far, we will probably continue our meeting using the good sides of pandemic, so that we could travel between Prague and Tübingen, actually being in virtual America. So thank you very much. They kind of don't see any more question of our participants who probably have to digest all the news, all the knowledge they got. So thank you very much. Thank you PhysioAssist for that session, and we continue to work to provide better care for our patients who really want it, deserve it, and hopefully all the best for everybody. Keep negative all the time, and see you next time. Thank you.